one of the primary cause for all TMDs, that is temporomandibular joint disorders, that means all your pains in around the ear, in the joint, jaw joint, or your these muscles, or headaches, migraine, temporalis, which is a big fan shaped muscle on the side of the head, if that is aching, or the back of the head is aching, is because when your jaw is put under excessive movement, the night grinding or bruxism, it goes into that fatigue mode and it starts aching, and that can also spread to your neck muscles and the cervical spine. So when these muscles are in a too much of contracted position and a stretched position, the easiest way to relax those muscles is with breathing, as simple as that. So there are two primary breathing exercises which is fantastic to relax your jaw muscles and get them into a normal stage, and they are extremely beneficial. The first exercise is Bhrahmari pranayama. So what you do in Bhrahmari pranayama is you just close down your ear canals with your thumb, put your thumb inside, and then forefinger on the face, like first on your forehead, second on your eyes, just lightly place it over your eyes to close the eyelids, then the third one on your upper lip and the chin. So just lightly, do not press it too much, just lightly hold it. This is to just close your all senses, like close down your ears and block your ear canals and close down your eyes, and just take a deep breath and exhale humming. Yes, very nice. So this humming has to be done in a very high pitch, as high as you can. So when you do that humming, there is a lot of vibrations which are created, and that vibration will help to relax your jaw muscles, and you will certainly feel a lot of difference after just 5 sessions of Bhrahmari pranayam twice in a day, that you have to do just before you sleep and after you wake up, just 5 rounds of Bhrahmari pranayam. The second is called as box breathing with slow exhalation. So what does that mean is, you have to just sit straight, either on a chair or you fold your legs and sit in a swastikasana, and take a deep breath, holding 1, 2, 3, 4 is inhalation, then hold it for 1, 2, 3, 4, which is called as a kumbhak, then exhale slowly, 1, 2, 3, 4, 5, 6, and then again hold 1, 2, 3, 4. So that completes the one cycle. Like count of 4, you are slowly inhaling, holding it for 4 counts, which is kumbhak, and exhaling for 6 counts. So exhalation has to be longer than the inhalations, and then again you hold for certain time and then again inhale the second cycle. So such 5 rounds before you sleep, 5 rounds when you get up in the morning. So deep exhalation, science has shown to create a lot of relaxation in your body muscles, and whatever those tense and contracted muscles are there, they get relaxed. So these two breathing exercises, Bhrahmari pranayam and box breathing with a slow exhalation, is the way to relax your jaw muscles. Now, what is the correct tongue position? So the correct tongue position and why it is important. So just to tell you, the tongue, normal people don't know where the tongue is positioned because they have never thought about it. Now, a lot of people have a lot of spacing in the teeth. One of the primary reason for the front tooth spacing is the faulty tongue position. So if your tongue is touching the teeth and throughout the day it is constantly lying against it, it will start spreading the teeth. Also, if your tongue is falling down, touching the lower teeth, then and not touching the palate up there, then that also will, what it does is, our upper teeth are balanced by tongue and the cheeks. So teeth are in between the tongue and the cheek. So when the tongue falls down, the cheek pressure increases and it will start contracting the arch, narrowing the arch, which can lead to crowded teeth, overlapped teeth, and all those issues. Again, it will also affect your breathing. How you breathe is primarily governed with the tongue positioning, and you all know how much important the breathing and the correct oxygenation of the body is, especially when you sleep at night. So what happens is, as you can see in the picture above, when you sleep, you on a sideways, The tongue, if it is touching the palate, which is the correct way to position your tongue, and it is vacuumed against the palate, it is holding there. But suppose if it is not touching the palate and it is lying down, touching the lower teeth, it tends to fall back because of the gravity. And when the tongue falls back, your airway, the windpipe, gets narrowed, and the air has to pass through the narrow passage like above, where it gives that snoring sound. And when tongue falls back and completely blocks the airway, it goes into apnea. Suddenly you have seen a lot of patients waking up middle of the night, grasping for breath and sweating and all. It's because it's the body's reaction to, I'm not getting oxygen, just wake up. So those things. Secondly, also a lot of people grind and clench their teeth. Grinding and moving your jaw forward is also a sign that tongue is falling down, blocking the airway. So it's body's reaction to move the lower jaw so that tongue again comes forward and the airway opens and the body gets oxygen. That's how the importance of the correct tongue position is. That grinding teeth also can cause a lot of wear in the lower anterior teeth when it happens because of the breathing difficulty. Now, let us understand how the tongue position can be corrected if you have a faulty tongue position. So, the correct way to position, know where is the correct position is when you say the words no, now, never. Just say those.
No, now, never.
So now when you just realize, when you say the word no, now, never, your tongue touches the palate front part behind the upper teeth. So that is the correct way, and it is not that it is supposed to touch only there. The whole tongue should get adapted towards the palate. So if you have a faulty tongue position like this, just put a reminder in your mobile phone every 1 hour. So every 1 hour it brings you to awareness where is your tongue position, and just try to be more aware and make sure your tongue is not touching the teeth or falling down, it's against the palate. That is the first thing. Secondly, there are few exercises, tongue exercises, which will help you to relax your jaw muscles. Now a lot of patient has a lot of headaches when they get up in the morning, or some jaw pains or neck muscle pain, cervical pain. So when people tend to clench their teeth at night or throughout the day when they are busy in some work and they tend to just keep on biting, that will fatigue those muscles. And there are few tongue exercises which will help to relax the jaw muscles. So one of the first main exercise is the lion pose, which is also called as a Siha Mudra. So what you do in lion pose is just stick out your tongue as out as possible. Correct. Just hold it there for a few seconds, and also you can move right, left, right, left. So maybe 30-40 seconds as long as you can, and then just take it in and swallow. While swallowing, make sure your tongue is not touching the teeth and it is behind the upper front teeth. So this Siha Mudra or lion pose, you can do it either sitting on a chair or in a Vajrasana if you are comfortable. And when you're sitting in the Vajrasana, you can just lean forward so as to get the maximum stretch of the tongue. Also, if it is folding your legs backward is not possible like Vajrasana, you can just fold normally in a Swastikasana. So that's the first exercise of lion pose. Second is rolling it behind, which is called as a Khechari Mudra, where you roll your tongue as back as possible. Once you start putting it backwards, there is a hard palate, and suddenly you feel there is a softness, which is soft palate. So go as back as soft palate and hold it there. Correct. Now hold it there for a few seconds as long as you can. When you are doing that, just make sure your breathing is normal. Normal in, deep breathing, deep breathe out. After holding for 30-40 seconds, then again swallow. While swallowing again, as I said earlier, make sure your tongue is not touching the front teeth. So throughout the day, the swallowing, putting the tongue at the ideal position is of utmost importance. Third one is, suppose if you cannot open your jaw too wide like in Siha Mudra, you can also do which is called as a controlled mouth opening with fixing your tongue in a certain position. So as I said earlier, no, now, never is the area where you're supposed to put your tongue. So just put your tongue there, okay, and keep holding tongue there and open. Don't lose the tongue grip over that area, and close. Again open and close. So do this 25 times when you get up in the morning, and throughout the day, such 3 sets you can do it. So that is a controlled way of opening without hurting your jaw. If your jaw is in a locked position or too wide opening is painful to you, you just do this 25 times, 3 times a day. It will relax your jaw. The first two exercises like a lion pose and the Khechari Mudra, you can do it 5 rounds morning when you get up in the morning and before you sleep at night. So twice in a day. When there is a locked jaw or a strenuous muscles and the tense jaw muscles, it also can extend to your neck. Your neck can also become stiff. People who have the clenching and grinding habit at night when they are sleeping, when they wake up in the morning, they wake up with a sore neck. They feel, I must have slept on a wrong pillow, or maybe I must have slept the wrong way, but usually that's not the case. Is basically that night they must have clenched or grinded that teeth too much, so that that muscle, neck muscle, became stiff and tight. So how to relax those neck muscles is, you just take any routine chair, sit straight. Then suppose if you have to stretch your left side, then just hold your hand to the side of the chair and make sure this the shoulder does not lift. So it is just to control your shoulder to it one and then just stretch. So again here important thing is to not to look down, always it has to be just and with this hand tightly controlling the other side, and you feel the stretch of your neck muscles. Hold it there for say again 15-20 seconds, and important thing is to take a deep breath, inhale and slow exhale. Feel the stretch, enjoy the stretch, and then again the other side. Just hold your tightly there, control your shoulder, not to look down, and just feel the stretch in the side of your neck muscles. Again this do 5 rounds when you get up in the morning if you suffer with the stiff neck when you wake up in the morning. So today we'll be talking about postures. How posture affect your jaw joint? Yes, your posture and the jaw joints are connected. When a lot of patient has the TMDs, temporomandibular joint disorder, or jaw pains and the locked jaws and jaw related issues, the muscle paining, the headaches, a lot of time we have seen they have a faulty dorsal spine, which is the upper part of your spine, which is called as a dorsal spine. It is curved, and that primarily happens when you just have a desk job sitting and doing it. Your shoulders droop. It also affects your breathing. Now when the shoulders droop, your lungs do not have a area to expand while inhalation, and you are always doing a shallow breathing. So there are few exercises which will help you to correct your dorsal spine and expand your chest. So one of the primary and the main exercise is Gomukhasana. So what you do in this is, you just take one hand out, stretch it as high as you can, take it back, and with your other hand you join it. Just show it once. So here the important thing is to not look back, not look down. Always your head should be straight, and your, suppose if you are not able to touch your fingers, take a small napkin or a hanky and just, it's not important to touch, important is to feel that stretch, and that stretch has to be kept for say 30-40 seconds, as long as you can. Even if you can hold for a minute, nothing like it. And when you are holding it, just make sure your breathing is normal. Don't strain your breath and hold your breath. It has to be slow deep exhalation and slow deep inhalation. Hold it as long as you can, and then just reverse the other side. You will notice one side is not as flexible other, which is again a normal thing to happen. And again, as I told you, not important to touch it, but feel a maximum stretch and make sure your head is straight, not looking down. So that is these exercises you can do 5 times when you get up in the morning. That will just relax your neck and the cervical spine. And again, the second thing is, throughout the day, make sure your shoulders are back and not drooping down. You have to shoulders back, head straight. Again, another very popular exercise to get a full body stretch is Suryanamaskar. That is a fantastic thing where you just get a full stretch of body. So if you can do 5 Suryanamaskar or even 10 Suryanamaskars when you get up in the morning, it is a wonderful thing to start your day with.
So we have discussed about holistic approach towards temporomandibular joint disorders. Now let's talk about TMJ SPlints. So doctor, please explain us about TMJ SPlints.
Yes. So there are various kinds of splints which we use to treat TMJ disorders. The choice of the splint depends upon what kind of the problem patient has. So it's like a prescription glass what you get it. So ophthalmologist measures your eyesight, has a different yardstick to know what kind of a prescription you require. Similarly in TMJ, we have like whether it's a joint problem, whether it's a muscle issue, are there any other associated disorders. So depending upon, once we take a history of the patient, examine the patient, we know which kind of a splints are there. So one of the type is like a stabilizing splint, where it is a full coverage stabilizing. There is another type of splint called as a repositioning splint, so where we push the lower jaw forward so as to it is little away from the joint space to relax the disc. There is another kind of a splint which is called a deprogramming splint, which relaxes the jaw muscles. So as per the requirement of the particular patient, we customize and use the splint.
Doctor, most of our patients are really confused between night guard and splints, TMJ SPlints.
Right.
So please throw a light on it.
Sure. So yes, night guards and splints, these are the two terms which are very often used interchangeably. So there is a lot of difference. I mean, splint is like a, as I said, prescription glasses where it is customized. Of course, night guard are also customized, but their main purpose of the night guards are to prevent the dental damages which happens because of the grinding and the bruxism. So whenever the person clenches his or her teeth tightly, or they have a habit of side by side jaw movement leading to a lot of teeth wear and tear, their night guard plays a role. So there are again different types of night guards available. There are something called as a soft night guard, which are very soft and flexible. They're comfortable to wear, but most often I don't prefer to give them because it's a very soft and many times it feels like a chewy feeling. So there is a fear that person might increase his grinding or clenching because of the soft feeling of it, which feels like a food. There's another thing called as a soft and hard. It's a combination where inside is a soft, outside is a hard. That can be used very often. And another variety is completely hard one, where it is very hard. These are generally for a patient who are a very heavy bruxer or heavy grinder, and it does not wear off that easily, and it protects the dentition. It acts like a buffer between the upper and lower teeth. So a lot of patients also ask whether I need for upper and lower both the jaws, but no, we need just some medium in between the upper and lower jaw, which will act like a buffer. So a single either upper or lower, whichever is comfortable, can be used as a night guard. Splints are totally different. So yes, we have come to an end of our TMJ disorder series, where we have talked in depth about what is TMJ and TMD. What are the factors which affect your jaw joint problems. We have also talked about the management, how we have developed a holistic approach towards the management of the TMJ related issues. Right from the taking in detail the history about your problem, examining your joint, identifying where is an issue, is it at the joint level or at the muscle level, or what are the other factors which are troubling and leading to those TMJ related disorders. We also talked about the holistic approach, right from the breathing exercises, tongue exercises, the curale sessions, what we give it to our patients. Also about those specific exercises which is customized depending upon which kind muscle is affected in a particular patient. Also we spoke about the splints, different types of it and aspects of the TMJ management, like sleeping patterns, food, which also helps us in overall healing process. So there is no generalized treatment which everybody can follow. So if you are suffering from any kind of the TMJ kind of issues like a headaches or migraine or tinnitus or earache or vision issues, cervical spondylitis, numbness in your fingers, all can be because of the TMD related disorders. So there is no general treatment approach which ideally should be followed. It has to be very customized and specific to that particular patient and what kind of a problem they are suffering. So if you have any such questions, you can speak to your dentist or a TMJ specialist about it. And if you like to visit us, our address and the website are given in the description, and we'd like to help you out come out of your problem.